Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the involved myocardium and blocked vessel and ECG leads involved? So if you see this, the myocardium, if the anterior wall of the myocardium is involved, then the blocked vessel is left main stem. Then ECG leads, where you see ST changes are V1 to V6, lead 1 and AVL. Then if the involved myocardium is anterior septal, then left anterior descending artery is involved, and here mainly the leads V1 to V3 we can see the changes. Then if it is lateral myocardial infarction or lateral wall of the heart is involved, then it involves left circumflex artery, and here leads involved are leads 1 AVL, V5 and V6 are involved. Then we have inferior wall of MI. In inferior wall MI, the main artery involved is right coronary artery is involved in inferior wall MI. Here lead 2, lead 3 and AVF are involved. Then we have right ventricle. In the right ventricle, the blocked vessel is actually right coronary artery again. Here the leads which are involved are V4 to V6 are involved. So this is the involved myocardium and the leads which are involved.
thank you and thank you for watching.